So reproductive success is the key to natural selection. But in today's society, the increasing cost of raising a child have caused the need for assistance with preventing pregnancies and controlling the susceptibility to contracting diseases. Once a male hits puberty, his body is able to go through spermatogenesis, where a germ cell becomes a mature sperm cell in a 74-day cycle. At this point, a male can deliver more than 100 million sperm cells in one ejaculation. When a female is born, production of oocytes begins but is paused until she reaches puberty. Females are said to be on a clock because at birth there are over 2 million primary oocytes present, but that number depletes with time when a female ovulates. If the oocyte is not fertilized by a sperm, her body excretes it through menstruation. There are different types of birth control methods that male and females can use to prevent unwanted pregnancy. The birth control methods vary for each person, which can have its advantages and disadvantages. Birth control methods used today: abstinence in males and females, vasectomies by males, withdrawal by males, condoms by males, cervical cap or diaphragm is used by females, intrauterine device, otherwise known as IUD, is used by females. Tubal ligation is used by females. Fertility awareness method, otherwise known as FAMS, is used by males and females. Hormonal contraception is used by females.
What are the different types of abstinence? Well, one is absolute abstinence, including not engage in sexual intercourse or sexual activity with another person. Two, some people believe that abstinence means that as not having sexual intercourse during the cycle where they have made the most fruit. And number three, some people refer to being abstinent as not having sexual intercourse, but do other sex play is but do other sex play is okay. Here we had vasectomy effective for birth control. Vasectomy is one of the most effective kind of birth control. Vasectomy are almost 100% effective to preventing pregnancy. After the procedures take about 3 months of your semen to become sperm-free. The risk of pregnancy after a vasectomy is absolutely 1 in 2,000 for men who have a sperm count of 0 and a post-vasectomy semen analysis. A vasectomy is already effective because it's designed to be permanent, but it won't protect you from or your partner from STDs. Vasectomy effective birth control continued. Cost is low to perform a vasectomy. It's one of the most cost-efficient forms of contraception. The cost is thousands of dollars cheaper than sterilization methods for women. It also has a low health risk. One of the reasons is that a vasectomy avoids associated with general anesthesia. Of course, one of the great benefits of having a vasectomy is that it often covers by your insurance.
Withdrawal is birth control. Withdrawal is when a man removes his penis from the female's vagina before ejaculation. This results in 18 pregnancies per 100 women a year, and is widely used because it is free of charge and doesn't disrupt the flow of sex. The issue is that it requires self-control on the man's part. If the male doesn't make it all the way out of the vagina, the sperm will swim towards the female's egg, and in the event of pre-ejaculation, the encounter will result in an unplanned pregnancy. Condoms as birth control. Condoms are the only method that protect against sexually transmitted infections like chlamydia, gonorrhea, and AIDS, HIV. If used correctly, the condom is worn over the penis to keep the sperm out of the vagina. This method is not typically liked among men because it reduces their sensation and sensitivity. Women do not typically like this method because it interrupts the flow of intercourse, while the man has to pause to put the condom on. To make them more appealing, companies have introduced a variety of condoms. Some increase pleasure, while others are said to feel like it's not there. Allergies to latex do not include condoms. There are also varieties of condoms made without latex in them. Cervical caps and diaphragms as birth control. This method kills sperm and blocks the cervix from sperm entering. It is not very expensive, but rather difficult and time-consuming to insert. Once inserted, it can be worn safely for 24 hours. This method cannot be used by everyone. The cap may slip out of place and is less effective in women who have already given vaginal birth. They are unsuitable for a woman who is severely obese due to placement difficulties. The cap shouldn't be used if the female has cervical cancer or is awaiting treatment for cervical cancer. And it cannot be used if the woman has a distorted cervical anatomy, kind of like a tilted cervix. The Center for Disease Control has established many risks. Toxic shock syndrome is if worn for too long, increased risk for urinary tract infections, and it can cause slits in cervix, making the female more susceptible to HIV infection. Spermicidal cream causes many issues.
IUD stands for intrauterine device, shaped like a T and a bit bigger than a quarter. An IUD fits inside your uterus. They are not for everyone, but today's IUDs are considered both effective and safe for most women. It prevents pregnancy by stopping sperm and reaching and fertilizing eggs. There are 5 types of IUDs available in the United States: Lydia, Kyleena, Mirena, and Skyla. These types of IUDs tend to make your period lighter and may be a good option if you have heavy periods. Paragard, also known as copper T IUD, the copper triggers your immune system to prevent pregnancy. It can cause your periods to be heavier, especially at first, but Paragard lasts longer than hormonal IUDs. If someone does get pregnant while using an IUD, they're at a greater risk of issues like an infection, miscarriage, preterm birth, and ectopic pregnancy.
What are the different types of abstinence? Well, one is absolute abstinence, including not engage in sexual intercourse or sexual activity with another person. Two, some people believe that abstinence means that as not having sexual intercourse during their cycle where they have made the most fertile. And also, and number three, some people refer to being abstinent as not having sexual intercourse, but do other sex play is okay.
Fertility awareness methods, aka FAMS, helps females track their ovulation. Natural family planning and the rhythm method are other names to call it. And the effectiveness of FAMS is about 76 to 88%, meaning in the range of 12 to 24 out of the 100 couples will get pregnant each year, depending on the method used. A female can make FAMS more effective by working with professionals like nurses, doctors, or a counselor. Time and discipline to check fertility signs and mark cycle every day. Not having a problem with using another birth control or avoiding intercourse during fertile days. Different types of FAMS are temperature method, which is the female takes her temperature in the morning every day right before getting out of bed. Cervical mucus method, which is every day the woman checks her cervical mucus, aka vaginal discharge. And calendar method, which is using a calendar or a planner. The woman charts her menstrual cycle. These methods are most effective combined, which is called symptothermal method. There's a bonus method called the standard days method, which is the woman tracks her menstrual cycle for a couple of months to decide if her cycle in between 26 and 32 days long cannot be longer or shorter. Then the woman uses another form of birth control or no intercourse on days 8 through 19, which are the fertile days. Hormonal contraception contains a progesterone medicine with or without an estrogen. They can prevent pregnancy by prevent ovulation, make mucus around the cervix thicker, not allowing the sperm to enter the uterus, or make the lining of the uterus thinner to not allow an egg to from attaching itself. Different types of hormonal contraceptions are oral contraceptives, which are pills, and they contain both estrogen and progesterone. Injectable birth control, which is a form of progesterone birth control and given to by a shot every 12 weeks. It may be taken up to 12 months for you to start ovulating again. A skin patch is a form of both of the hormones, which is given weekly for 3 weeks and allows a patch-free week. Vaginal ring, which is a flexible small ring containing both hormones. It's given it can be used continuously for 3 weeks, and the following week can be without the ring. Um, Progesterone contraception, which is a small device that is given to you by a doctor. And the doctor put it in the uterine cavity, and it could be used up to 5 years. Implantable form, which is a single rod containing progesterone, and it could give it to you by a doctor underneath your skin, and it's effective for 3 years. Avoid hormonal contraception if you have or had blood clotting disorders, have or had stroke or coronary artery disease, heart disease involving the valves with clotting issues, high blood pressure, diabetes with circulatory problems, headaches with neurological symptoms, major surgery, or have or had breast cancer. The risks of taking hormonal contraceptions are breast cancer, which is a small number of studies that showed an increased risk of breast cancer in women under the age of 35. Bone strength, which is from the injectables, and its short-term decrease in bone mass. Heart attack, which is extremely rare, but from family experience, I know that could be a factor, and it's an increased risk for those who smoke over the age of 35. Stroke is very rare also, but if a female has headaches or migraines through visual changes, and she is or over the age of 35 and smoke, it could be a problem. And blood clots, which is it is a low factor, but it can happen, and it's from the form of estrogen, and it's risk for females who had family history, or had a history of blood clots.
Here we see how effective a vasectomy is. If you look at the typical use there and the percentage of women experience an unattended pregnancy within the first year of use, and a perfect use. Typically, no methods, 85%. Perfect use, 85%. So that's about the same. The withdrawals, 29% to 18%. Using a diaphragm for birth control, be 16% to 8%. Condoms, and with the females, 29%. Perfect use is a 5%. Male, 15%. Perfect use is 2%. Combining pills and polycyclic pills, you get 8% to 0.3%, and male sterilization, which is very expensive, 0.15% to 0.10%.
In conclusion, in effectiveness of controlling disease and infection, condoms and abstinence have the highest effective rate. In reducing risks of unwanted or unplanned pregnancies, vasectomy and tubal ligation are the most effective because of the removal of the reproductive organs in the respective sex. Withdrawal, hormonal contraception, and condoms are the most used across all demographics. However, not all of them protect against disease and infection.